right, well, we're going to go ahead and get started. We have one more committee member coming, and we'll let her slip in. I want to thank everybody from the committee for coming in today. We may be small, but we're certainly important to hear this issue. So please don't think that, we don't care about the issue. Tanika, do you want to go ahead and be first and present the problem or what you'd like to say? And Tanika is the founder, for the committee members that don't know, Tanika is the founder and executive director of the White Dress Project. Wow.
That's on. Good afternoon.
Good afternoon.
Good afternoon. My name is Tanika Gray Valbrun, and I just wanted to start by thanking all of you representatives for your time and your support of this issue. I would be remiss if I didn't acknowledge Madam Chair Cooper, who has given me so much guidance and support around this issue. When I came to her as a patient advocate, she was so willing to hear my story and help me out and guide me through this legislative process. So I really appreciate everything that you've done to support me. So thank you. And to the rest of the representatives, thank you for being committed to participating in this study. So before I get started, I really have to acknowledge the fact that being here today is so important because I think it's imperative that we ramp up the conversation about uterine fibroids. And I'll just start with some statistics, and it'll show you that this conversation is well overdue and something that needs to continue. Uterine fibroids are the most common non-cancerous tumors in women of childbearing age, and the second most common reason these women undergo surgery. 80% of women by the age of 50 will have fibroids. African American women have 3 times the prevalence of fibroids than Caucasian women. African American women have more and larger fibroids and have more complications with myomectomies, which is the surgical removal of fibroids. Even though more than 200,000 hysterectomies are performed each year for uterine fibroids, and the annual direct cost for uterine fibroids in the U.S. exceeds $2.1 billion, little is known about fibroids and how to prevent them. Uterine fibroids can cause infertility depending on their location and size. Fibroids are the indication for more hysterectomies than any other single diagnosis, and uterine fibroids can lead to significant pain, bleeding, and fertility issues. Treatment options include wakeful watching, which, we have, Dr. Davis-Williams will probably talk about today that is not the most effective method. Treatment with drugs or hormones, embolization or ultrasound, invasive procedures such as partial or total hysterectomies. However, there is little evidence about the effectiveness of these therapies or their outcomes, including fibroid reoccurrence and women's ability to have children. So why is this advocacy and legislation important? Why am I here today? Why are we doing this work, which is so hard to definitely on a grassroots level get people involved and get them, to support a health issue? But the other day I had a conversation with a group of our community women, and some of them talked about the limited knowledge that there is about fibroids and how they have also altered their state of normal. So I'll just read a quote from one of the ladies that I spoke to that will exemplify the limited knowledge that we have about the issue. She says, "With a bachelor's and master's degree in science and chemistry, I had not known about fibroids. Thinking back to anatomy and physiology classes, we talked about having babies, talked about different forms of cancer, but did they ever mention fibroids? I don't think so." Another young lady talked about how when you have fibroids, your altered state of normal. So how you start to think that the symptoms of fibroids are just normal life. I quote, "My period lasted for 30 days, and it was heavy, and it was horrible. I was wearing pads like the size that you get in the hospital after you have a baby. And I was so used to that happening at that time, I didn't call anybody because, it was normal." I can attest to that, and I'll share a little bit of my story with you because for me, this fight is very personal and very close to my heart. My mother lost 4 children to fibroids, 2 sets of twins. So she got pregnant with a set of twins, lost those. She decided to adopt because she figured she couldn't have children because of the fibroids. She adopted, got pregnant with me, and then after me lost a set of twins. So in essence, I was her miracle baby, and I'm an only child, so I was her baby that she thought that she couldn't have. So because my mother shared that story with me at a very early age, it allowed me to know the symptoms that are prevalent with fibroids. So when it started to happen to me, I wasn't completely alarmed. However, I was still one of those that waited and watched and decided that I was going to alter my life and compromise my quality of life. So I was that young lady that always had pads in the car, always wore 2 pairs of leggings. When I stand up, I always look behind me on my seat. So it's that altered state that you become accustomed to because you never know what's going to happen when your fibroids come or when your fibroids act up. So fast forward, I got married. I went all through college, dealt with it, never went to white parties, never engaged socially with white. And while that may seem like a simple thing for a college young lady that wants to, indulge in social activities, something like that could compromise your quality of life. So went through all of college, got married in 2012, and right after we got married, we went to a doctor to talk about, fertility, starting a family, all of that. And the doctor said to me, he was at Piedmont, he said to me, "Ms. Valbrun, you need to go ahead and save your money because there's no way you'll ever be a mother." And of course, I was devastated because I had just gotten married and, you feel like you do everything right. My husband's here to attest to that story. But you feel like you do everything right and you don't have this opportunity to become a mother. So a month after that, I met Dr. Davis Williams, who is here today and has been so supportive of me as a patient and just supporting me through this journey. And she said to me that my life wasn't over and I could be a mother, and that she was going to treat me and do what she could to help me through this process. So we started to take some drugs. Some of the drugs didn't work out well for me, and I had to have emergency surgery, and Dr. Davis Williams removed 27 fibroids from my body in July of 2013. So when Dr. Davis Williams speaks, she'll show you some of the sizes of fibroids, and I have a little PowerPoint here that I can just reference to show you the size of my fibroids.
It's already open.
Oh, is it?
It's minimized.
Oh, okay. Thank you.
Yeah. To the right of that.
So I'll talk a little bit about my company and then I'll be done. But if you just look at that middle picture in that collage there, those were the size of my fibroids. So that was when I was on WGCL with Alicia Thomas Morgan, who was the first representative who helped us, who sponsored the resolution to declare July as Fibroids Awareness Month. So I had 27 of those come out of my body, and I've always pretty much been this frame. So I was always that, small, slender girl that had this protruding belly. So I would always look like I was pregnant. Really, once again, altered my life and really found ways to camouflage my wardrobe, would never wear white. So it really became something that damaged and interrupted my quality of life. So after my surgery and during recovery, I really decided that when I Googled fibroids, there were all these marketing tools around, UFE, and really not telling me statistics or who was affected or why do we get fibroids, why are they prevalent in the Black and Caribbean community. So I decided that I wanted to do something about it, so I did. And I connected with Representative Alicia Thomas Morgan, and she sponsored the first resolution that declared July as Fibroids Awareness Month in the state of Georgia. So since then, we started a movement, and that's what the White Dress Project is. And from my speech, hopefully by now you've recognized why we've called it the White Dress Project. When I came back from surgery, finally got enough strength to walk up the stairs in my home, and I went into my closet, and at that moment, it was such an aha moment for me when I realized that I had not had any white in my closet. And like I said earlier, that may be something that is trivial, who cares if you don't have any white? But for me, it symbolized how I had limited myself for so many years. So that's where the name comes from, because when you have fibroids, you never know how your period is going to react, and you never know what accidents you can have. And I can share accident stories with you, but I don't want to belabor your time. So I will not do that. But that's where the name comes from. And we've really started a movement. And I put that picture of my mother in there because she was the one who really instilled in me the importance of getting educated about your health and your body. And I'm so happy that she shared her fibroids journey with me because, her losing 4 children is detrimental to her, but I also lost 4 brothers and sisters. And when you're an only child, you always want a sibling. So her story is my story, and we've shared in that interconnectedness. So from that, we have started a movement, and these are all women who have fibroid stories. The writing on there is their fibroid story and how they connect with having uterine fibroids. One lady up there to the left in the middle had to have 4 myomectomies, which is the surgical removal of fibroids, and I think 5 IVF cycles to have her one miracle baby, who she talks about all the time, Nia. So we've started a movement, and our slogan is, I can wear white because, and we talk about our stories. And I just put that picture in there because our first year, 2014, we were extremely successful in connecting with legislators. That middle picture was our first event at the Capitol with Lieutenant Governor Casey Cagle, and those are other events that we've had around the city, at the City Hall, the Fulton County Commissioner. So we've really had a lot of support from legislators. DeKalb is on there as well. And we have not only done great work in Georgia, but we have done quite a few things around the country. Since last year, we have gotten 4 states to declare July as Fibroids Awareness Month, including the city of New Orleans. So we've gotten New York, we've gotten Georgia, obviously, Florida, city of New Orleans, and Pennsylvania. So we're really excited about that. We've also gotten a U.S. House resolution introduced through Congressman David Scott that was introduced last year, and also co-sponsored on that was Representative Edwards from Maryland. So I have been a busy bee, and I am proud of the work that we have done and will do for fibroids. I just want to wrap up by going through this packet that I put together for you. And in it, it just has some goals that I want for this study committee, what I'm proposing. And pardon my ignorance that, I probably shouldn't have done that, but, you do it and then ask for forgiveness later. So in there is just some goals for the study committee, what I feel, as a patient advocate, I would like to see happen, and what I feel like our community would like to see happen. A little bit about our organization, and right now we probably have reached about maybe 5,000 women over the space of a year, about 10 countries. So we're really excited about the growth that we're having and the reach that we're having. I have my bio in there and Dr. Davis Williams' bio, just to let you know who we are, where we stand, our background, and why this fight is so important to us. I also have the resolution in there that Madam Chair got sponsored for me and was able to get passed. The most important page is the recommendations for the committee, which is probably the 4th page in. And you can peruse this document on your own, but I really just want to point out some of the things that I foresee happening and what I feel is necessary. The first bullet is research and education. I think it's so imperative that the research that we have out there needs to be ramped up in comparison to other medical conditions that impact women's health so tremendously. The scientific research devoted to uterine fibroids is seriously lacking. The health of Georgia's women depends upon the state increasing the study of this medical issue. And I'll just go down to the second paragraph there. With respect to education, a significant need exists for dissemination of information regarding the condition to the women who are affected by it. You know, I'll just give an example of what that looks like for me. For me, I would like to see every OBGYN's office have a pamphlet about fibroids. And I'm not saying it doesn't exist at all, but I know that there are many gynecological offices that don't have any information about fibroids. And I'll go back to that altered state of normal, that as a woman, you know, if you haven't had a mother like me that has explained it, or even had anyone in your family who has had fibroids, then there's a possibility that you don't know what fibroids are. And you're thinking that my period is just heavy. I just cramp like this. And as women, we're really not discussing it amongst one another. You know, it's not like we're saying, how many pads did you change today? How, you know, why is your belly so? So those are conversations that we're not having. So because we're not having them, then the communication within the community is not happening. So every time I go to the doctor's office, I see a cancer brochure, or I see something about lupus, or I see something about diabetes. I think that's something that is low-hanging fruit that we could do. The second thing is committed to developers. Ultimately, the goal is development of a cure and or attainable treatment options that do not significantly hinder the patient's lifestyle. Georgia should commit to identifying and providing support to researchers, scientists, doctors, and other individuals in Georgia that are actively involved in the treatment of this condition, who are committed to developing a cure. I recently went to a conference in North Carolina in the Research Triangle at North Carolina Central University in partnership with Duke University. And there's a doctor there named Dr. Darlene Taylor, and she is developing a drug right now to go through the FDA process called lipogel. And her hope is that she will be able to develop this drug and that it will be go through the FDA process and be readily available to doctors for patients, that they are able to inject this drug into the fibroids. So this is a non-surgical treatment, and it will shrink the fibroids from there. So there's a lot of work being done around fibroids research, and she's literally in her lab every day testing this so that she can get it to the FDA. So I feel that someone like that should be identified in Georgia. And once again, pardon my ignorance that someone like that could already exist. But on the grassroots level that I am right now, I personally don't know those doctors. So committing to developers is the goal of that bullet. And the last one is collaboration and centralization of information. I have been fortunate to be asked to join the Duke Clinical Research Institute Stakeholders Board. And we just had a conference in Baltimore a couple weeks ago. And they are in charge of a registry, a national registry called Compare UF. And I have two flyers in there about Compare UF. This last bullet talks about how we as Georgia residents and residents of Georgia need to have a site that is here in Georgia. The farthest site that this Compare UF National Registry covers is Vanderbilt University. So I feel it's imperative to have a site here in Georgia so that women who are living in Georgia don't have to travel to a Vanderbilt or a Northwestern, which is involved in the study. So Dr. Diamond, when I think Tara told me that he was going to be participating, he's also on the steering committee for Compare UF. So I think that it would be good synergy to have someone who is already involved in Compare UF to be a part of this. And then the last thing is our National Uterine Fibroid Education Coalition. And this is the thought that Georgia would be the first state to participate in this coalition with representatives, with companies, with pharmaceutical representatives who are all in the fight to advocate for uterine fibroids. I thank you so much for your time. I hope that you will review this information and know that 80% of women suffering with an epidemic is something that is not acceptable and something that we need to do something about. Thank you so much for your time.
Okay, questions from the committee for the presenter? Okay, Representative May?
I don't necessarily have a question. I came in the middle of your presentation, but it was so good.
Oh, thank you.
The
I
way you
appreciate
presented
that.
it, we appreciate it. We appreciate the work for having the leadership to start something that can spread the word at this level. And I just want to say thank you and keep up the great work.
Thank you so much. I appreciate your comment.
Other? Okay, go ahead.
I too share Representative Thomas's comment about appreciating you stepping up, and because a lot of times we don't have a lot of time to be able to kind of hone in on some of the issues that we think are important,
Right.
and so we depend on others like yourself to be able to step up, and then we can able to show support. And I definitely commend Representative Thomas, Alicia Thomas, for being able to help push you, kind of give you that push to keep going.
Right.
And I definitely like to encourage you as well to continue your fight, because there are women out there, even like myself, that know I don't have a white dress
Right.
because of those issues with fibroids. So thank you again.
Thank you, and I appreciate you sharing your personal story. And I must also add that Representative Erica Thomas is the one that got our 2015 resolution sponsored. So July declared as Fibroids Awareness Month in the state.
Okay.
Yes, ma'am.
Thank you, Madam Chair, and thank you for sharing and bringing this issue to our attention. And as I shared with you before, you know, I represent a lot of rural communities, and whatever we can do, committee members, to try to get this information out to the entire state of Georgia, especially in those rural communities where we have for instance, in my home county, we don't even have a hospital there. I represent 4 counties, and out of the 4 counties, I only have 1 hospital in the entire county. So people are having to travel quite a distance to get medical care. So I certainly want us to work really hard to get this kind of information out into the rural part of the state. But I thank you for your work and bringing this issue to the forefront.
Thank you, Representative Bentley.
Tanika, I think maybe that I'd like to direct you in some ways of going. I think that as far as information in the doctor's offices, I mean, we can direct you. In fact, I saw her in the Capitol, and she's another meeting, to Pat Coda, who is the lobbyist for the OBGYNs in the state of Georgia. That wouldn't get all of them, but that would get the ones that belong to the society. However, the state really doesn't have money to do pamphlets and all, or at least if it comes through public health, you know, you're sort of on the bottom of venereal disease and HIV
Right.
and
Right.
what money we have going to that. So I think usually the things you see from the Cancer Society and the Lupus Society are produced by those societies.
Okay.
And, you know, but I'm sure that as your organization grows, if you can come up with something that covers it, that, you know, then through the OBGYN Society, they could help get them distributed, I would think. But I'm sure that probably came with a national committee approving,
Right.
you know, what something is. So that would be one thing. The other thing is, Margie's with the Medical College of Georgia. I'm sorry, I'm calling it the old name where I graduated. Georgia Regents. Did I hear there was another? Huh? It's now Augusta University. How much are we paying for signs? Could we have that money to go for pamphlets for
Right.
on fibroids or something? No, they're going to put new signs up, I'm sure. Right? Okay. It's just going to be called Augusta University?
Each college will be branded, so it'll be the Medical College of Georgia at Augusta University, the Nursing College at Augusta University, the Dental College at.
Okay.
Which is better.
I'm a graduate of the Medical College of Georgia, so I'm going to go with that one. Does the state that you know of provide any significant amount of research grants on specific issues?
Dr. Diamond has arrived, and he's going to touch on some of the avenues
Oh.
for research, and then some research and some clinical trials that we have going on in the state right now. But I think, he's better to respond than I, but I think that there is not a significant amount.
Okay. Thank you. Dr.
Thank
Diamond,
you.
you still want to go last? Do we want to hear a practicing physician that treats people first, or you want to give us our research on what's coming up?
I'd be very glad to go at the end. That'll be fine.
That'll be fine. Okay.
Thank you again
very
for your
much
time.
for doing that. And so I'll call Dr. Camille Davis-Williams, who's with the Greater Atlanta Women's Healthcare and is out there, as somebody in my family used to say, amongst them and practicing day by day and dealing with these kinds of issues. Thank you very much for taking the time away from your practice to come and talk to us.
Thank you. And I guess I am here to entertain any questions about the illness. There are so many myths, I think, about the reproductive organ of women. So there are so many myths and so many misunderstandings. I think it's important to sort of get an idea of what the uterus does, what the ovaries do, and how those things relate, and at what point do they go to sleep and are no longer a source of issues, the ones that we're presently talking about. So when we talk about the uterus, the little...
I think she needs it.
Oh, you need it? Oh, sorry. So I brought the model, so
Okay.
we would all be on the same page. The small uterus is tiny, like the size of a ball fist. And there's a tube and an ovary on both sides. The ovary is like the comparable of the testis in a man. It gives us all of our hormones. The ovaries shrivel up and go to sleep around 48 to 52 years old, even though girls are starting earlier with the reproductive cycle and women are stopping later. Well, the uterus itself is the crib where the baby is formed, and once the egg and the sperm meet each other in the superhighway, is what I call the tube, it makes its way back to the womb, implants, and stays there, for the 40 weeks until delivery. The womb itself is a muscle bag, and that muscle bag is lined by very special cells that can receive a baby, unlike any other cells in the body. Well, those cells sort of sluck off every month as our cycle, but the thing we're focusing on is this muscle. So the muscle is there to contract when we are full-term pregnant, open up the cervix or the door to the womb, and let the baby come through the foyer to be delivered. Well, fibroids are created in the muscle of the womb. These rock-hard, cauliflower-looking tumors just develop in the muscle. Nobody knows why some groups of women have more than others, but certainly the majority of women end up with some by the end of life. If these tumors grow toward the lining, it can create overbearing bleeding. So a lot of women come in with overwhelming bleeding from fibroids, very anemic, some requiring transfusions, and that is the reason for intervention for a lot of folks. The womb sits here sandwiched between the bladder and the rectum. So if the fibroids are growing toward the outside and lean on the bladder, then it creates a challenge with bladder capacity. So then those women have pressure and urgency to urinate. And the fibroids can grow toward the back of the uterus and lean on the rectum and create issues of constipation. So its location ends up impacting several organ systems because of just where it sits. So there are several interventions in helping to deal with fibroids. The one that people talk most about is hysterectomy because it is the leading indication for having a hysterectomy done. There are now more minimally invasive procedures that are done to buy time and sometimes get a woman through her reproductive life and forever without having to have the definitive surgery, which is the hysterectomy. None of those procedures are perfect for sure, and we have just a limited amount of comparative information so that we can properly counsel outcomes in an appropriate way. So the state has registries for different illnesses. We keep up with illnesses that are declared an issue. And if something like this is impacting such a significant number of women, the goal that Ms. Gray presented of finding out who's impacted in Georgia, not just who's impacted, but what happened with the outcomes after intervention occurred. We have registries for, cervical cancer. We have registries for sexually transmitted infections. We have lots of registries to keep up with what impacts our community. So women talk to each other, women talk to separate providers, but we tend not to have appropriate conversations for the entire community.
Is it all right for me to interrupt you for a question?
Sure.
I don't think we've set up a registry since I've been here for almost 20 years. So if you have somebody that has HIV and we keep a registry that you pick up, how do you report that?
Well, now for HIV, RPR, and syphilis, a lot of the reporting comes through the labs where labs are drawn. But it really is the physician's responsibility to make certain those illnesses are reported.
So how would we, if we were to set up a registry for reporting fibroids and the surgery, how would the physician, I'm thinking about the time and, what it takes from the physicians who are already saying, they're so overworked, how would we report it where you would get enough to that or to public health, but why would they just do another form?
Well, the goal on the $20 million grant that Dr. Diamond will tell us more about is creating a registry so that a comparison of outcomes can occur. It's just that Georgia is not a part of a defined registry to do that.
Oh, okay. All right. I'll hold my questions. Dr. Diamond, seems like you've got the key to all of this. Okay. Where we're going with this. Okay. Thank you. Go ahead. I'm sorry.
Well, I came on invitation basically to give sort of an overview of the problem.
You're doing a great job. Thank you.
And,
Continue.
to sort of make certain we are all informed about what fibroids are, where they are. They tend to be estrogen dependent and grow during the reproductive life, sometimes with great growth spurts, sometimes with smaller growth spurts. There are interventions, and especially in Georgia, we hear a lot of marketing about particular interventions. And it would seem fairer to me for women to understand all of the options for care and for us to guard our population to make certain the safest and most appropriate options are being offered and done.
When you talk about options, you're talking about the different kinds of minimally invasive. Are you talking about rather than just a hysterectomy, which used to be the only option they have? You're talking about.
Yes, and we do myomectomies like Ms. Gray presented, where the tumors are taken from the uterus and the uterus left there and can be used for fertility if desired. If the tumors are growing toward the lining of the womb, we can do myomectomy from the bottom up and not from the top, where we can churn a fibroid out from the bottom, not like the morcellation we hear a lot about now. So what happens when we have sort of unbridled intervention, we end up knowing about issues once we have complications. So you hear about morcellations to allow minimally invasive surgery where fibroids from the top are churned so the uterus can come out from below. That in the country is no longer considered a viable option. And but you know, I can freeze the lining of the uterus to help with bleeding. I can do a myomectomy from below. I can do a myomectomy from above. Interventional radiologists can do fibroid embolization, where they put these little polyvinyl particles up into the blood supply of the uterus to cause a fibroid to shrink. So we hear a lot about that on the radio and MARTA. It's quite advertised in Georgia now. So quite a few women are, you know, knowledgeable about that option.
Okay.
Any other questions?
Go ahead. All right. Representative
Yeah, Representative Mabel Thomas. So I hear a lot about on the radio about it, you know. So are you saying is that the last one you mentioned that you even see advertised or even on the buses? Are you saying that is a viable option, or is this just people just getting into it because it's affecting so many women?
Well, it's certainly a viable option for the right chosen woman. So the thing that I would like to see is for women to be educated so that they know all of their options.
Yeah.
They know what the success rates are really for the procedure and the risk of recurrence of the fibroid later. And so it's definitely a viable option for a specific group of women.
But can you go further in terms of what specific, in terms of the way it's advertised as it's a solution for all?
I know.
It really is advertised that way. But so what specific, what would be an example of how a woman would fit into that specific category, the one that's being advertised about putting this?
Well, we gynecologists see women who have undergone the radiology approach, and in 4 or 5 years the tumors are back. And so if they are not counseled properly prior to undergoing the procedure, they feel like they have been maligned. And so I think as long as the counseling is proper and they realize that in general it is not a cure because we don't know what causes fibroids. And I'm hoping our educational institutions will be able to ramp up and do more research to see if there's some genetic link that can be impacted. Is it something environmental that can be impacted?
What about diet? Have there been discussions about diet, like
Well,
what we eat?
We know that weight impacts because we know our fat cells make a precursor of estrogen, and these tumors are estrogen dependent. So weight certainly impacts the growth rate of fibroids.
And the last question is, you talked about if it's if the fibroids are leaning towards the kidney, and then the lining. So in other words, is it possible for them to shift? And like, say, for it maybe at one point it's this way, and then does the fibroids actually shift? Could shift to another area?
No, they don't shift, but there can be so many, as Ms. Gray had, you know, over 20, and they can. Small ones can grow toward the lining, others can be right in the muscle, others grow toward the outside. Some of them actually can become parasitic on the bowel and start sharing blood supply with the intestine. They can be on a stalk, and over time that stalk could be so small. I operated on a woman yesterday, and it looked like her fibroid had lost its connection to the uterus. And after having an embolization, and it degenerated. So in that way, it appears that it had moved, but it certainly always starts with the smooth muscle of the uterus.
And last question for real. What if you are not in your reproductive age? Does the fibroid automatically just die or regenerate? I mean,
well,
degenerate.
They are estrogen dependent. When our ovaries go to sleep, our estrogen goes down away. And as that happens, fibroids certainly decrease the growth rate. And many times we get some shrinkage. A lot of times it's not quite as much shrinkage as a woman desires, because she feels that the fibroids may totally fade away. And that certainly does not happen most of the time, but they do not continue to grow at the growth rate when they were fed by estrogen.
Thank you very much. Appreciate it.
Representative Dickerson.
Thank you very much for this presentation, because it's been very informative. But I also wanted to know, when you talk about education, do you find, being that you are a professor as well as the physician, do you find that there are a lot of educational materials in the doctor's offices about fibroids?
Well, I think it's definitely available for sure, and every gynecologist has to deal with fibroids because it impacts so many women. I worry sometimes about the numbers of patients that doctors now care for, and so the communication sometimes is not where it should be. And I find women who have been to different providers and they didn't know, but the time spent and the communication piece, of course, always is better if it's increased. So the American College of OBGYN has information on fibroids. I'm on the board of the OBGYN Society for Georgia with Pat Coda.
Okay.
And when Tanika asked me to come, I thought we really should ask our society to get involved and make certain the gynecologists are helping to lead the way in education and communication to patients, one patient at a time, as well as en masse. Because if there's a gatekeeper, then inappropriate procedures wouldn't be done so widespread.
I agree with you on that, and I'm very fortunate to have one who does communicate and takes the time, because it is important when you go into a doctor's office that they take the time. Could you spread the word to talk to you?
I think electronic medical records are beginning to interfere. As you go into lots of doctors' offices now, they are on their computer as they supposedly are talking to you, and their eye contact is because they have to. I mean, they're having to see so many patients, and these are requirements, and it's just. I think they certainly have an advantage, but
I think we're struggling but learning how to incorporate that tool, because the gain is to have connections with the other doctors who are caring for her. So we aren't duplicating so many tests if we have access to it.
Right.
And I think the generation, certainly under me, are so internet savvy. I think more education is out there, but I worry because so much of that information is unedited. Everyone who decides to write can and put it there, and our population is really not trained to know how to evaluate what they're reading. So I think we will have to depend on our medical community to ramp up to protect women and offer the procedures that are the preferred for their stage of life, for their fertility, for the symptoms that they present with. And not everyone needs anything, but people who do really do.
Okay. Representative Clark.
Thank you so much, Madam Chairman. Doctor, your patient had 20 or so of these fibroids, and so what is the usual number that you would see in one of your patients?
It is so variable. You know, I have done huge myomectomies. Many of those women had come from doctors who wouldn't consider doing myomectomies for quite so many tumors. But for women who have not had the possibility of procreation and have never had babies, the definitive hysterectomy leaves them with some emptiness that I found, that it is hard to counsel through. And it actually gives, I think, the definitive hysterectomy a kind of bad name, because women who have completed fertility and choose to have definitive hysterectomy tend to be pleased. if they have used the womb for the reason it was created, in our opinion. So I can have a woman with one fibroid. If it is in the wrong place, she can just hemorrhage every month with one fibroid leaning toward the lining of the womb. And then she can have so many that her uterus appears to be 7 or 8 months pregnant. So it varies, and it's always a little puzzling to me, because some folk will come in with huge fibroids. They just didn't even know they were there. They kept getting wider waistbands and just assumed this is the new me, and they just didn't know. So when they feel the large tumor masses, they are, startled, because they just didn't know that mass was there.
And so, it depends on location, size, and so many things when it comes to infertility, you're saying also. Thank you so much. You've given such an excellent presentation, along with your patient who also did. Thank you.
Representative Stovall.
Yes. What is the normal way that you're able to identify the fibroids? Is it by the normal, I went blank.
Ultrasound?
Yeah, ultrasound is the normal stomach ultrasound or the vaginal. Which one actually gives you more of a clearer view of what's actually going on in the uterus?
Well, the first screen comes just from the pelvic exam. When the doctor lifts the uterus from the vaginal canal and feels it. That usually is our first tip, that there's a tumor mass there. And then, in general, gynecologists will do an ultrasound, and it can give us an idea of where the fibroids are located. And if the fibroids have started to organize themselves enough, the sound waves bounce off and it can be measured. If I do a myomectomy, I almost always find at least twice the number of fibroids that my ultrasound shows, but it gives me good impressions of what's there. We also then can do a sonohistogram where we put saline inside of the womb and do a vaginal probe ultrasound to see if tumors are impacting the cavity, see if she may be a candidate to have a procedure from below instead of the bikini cut major surgery from above. The interventional radiologists tend to rely on MRI to actually have even a better idea of the location and the size of the tumors.
You do such an excellent explanation. It's very educational. So I do agree with Representative Dickerson when she made that comment earlier.
Thank you.
Representative Bentley.
I wish I had met you back in 2011. I thank you for your presentation. It's been really very informative, as everyone stated. I'd just like to share and dwell on the importance of getting correct information out, because when I dealt with fibroids, I didn't realize I had options. It was just said to me that you have them, you need to have a hysterectomy, and told me what to look for that will indicate that they were growing, and everything that I was told was not happening. I didn't have the heavy menstrual cycles. I kept having the back pain, and in December 2012, right before I took office in January 2013, I had to have emergency surgery. And then in January 2013, I started working here, and I had a horrible session that first year. And I was very angry with my gynecologist for, just angry with them for what I had to endure that first year in session. But the education is very important, and just to be here and hear what you're saying, and knowing that there could have been some other options, and because it was just said to me, you have them, and we're going to monitor them and see how they're growing, and then we'll go ahead and do the hysterectomy. I wasn't informed of any other options or anything else that we can do. We're gonna watch for them, and they told me what to look for, and everything they told me, none of that happened. It's just that I kept having the back pain, and when I went back to the doctor, that's when we realized that they had really grown, and we need to remove them like today.
Well,
And
it is so important to have correct information
Yes.
to make a decision that impacts your life I mean, I have a woman who didn't understand that most of the interventions we do are not curative, except hysterectomy is the definitive surgery to remove fibroids for forever. And she thought her intervention was going to be curative, and she came to me to say, is this like a Tuskegee study? You know, because I didn't know. And she felt assaulted, to be honest. And so for that reason, I think it is just absolutely necessary that women are given proper information. And I applaud the work that Dr. Diamond's group will be doing to, in an objective way, look more at outcomes. So we'll have even more information to share.
So which leads me to my question of, you mentioned there's a society that gynecologists are a member of, and did I understand that correctly? How can I find out if any from my area of the state are a part of this society?
I'm sure they are, because it's a statewide organization, and I'll get the information to you.
Okay. Thank you.
I think we may have questions after Dr. Diamond speaks. We may have some more questions, but we have a women's caucus here that meets. There's about 40 women in the legislature. I don't go because I'm always busy, unfortunately, but I think you go. You're right. Don't you think she would make a great speaker? If you would come and do the same thing again in detail for it's always a luncheon, and I think that y'all usually have 20 or 25 of the women legislators. If you could ever spare that time again, I think that would be a wonderful thing for you to talk about the basics again. I think I'm the only nurse on the committee that, sort of understood what you were talking. And I taught OB one session because there was no OB professor that year, and it's they had to have somebody help me in the delivery room and that kind of thing. So I'm great on prenatal care and out once you're delivered. I'm great, but it was in the delivery room. I still cross my ankles when babies are delivered, but I think that would be a great thing for you to do. And I think there are probably a lot of the women in that age group, am I right, that are either have had them or maybe facing having fibroids and what to do about them. So I hope if they can give you enough forewarning so you could do that, I hope you would consider coming back and doing that for them.
I would make it happen.
So will you make sure that they know? And okay, thank you very much for coming today. Okay, Dr. Diamond, thank you so much for flying in from another conference and rushing over here. And don't I remember you coming and talking to something about marijuana? Do you get to do all the interesting issues down at the medical college?
This one is at least a little bit more related to my specialty and my subspecialty.
Okay.
So I'm very glad to be talking to you about this. Although the marijuana study is going well, we have 50 children that are now involved in it, and so the governor's initiative really been able to provide help to many, many families.
I mean, if the members do you know what's available? Remember when we had the discussion on marijuana, and I kept trying to tell people that there was a marijuana drug being produced in England made from marijuana that had been through the first and almost finished the second trials, and that we could get it on a compassionate basis, something that had actually been tested and was pure and didn't have, wasn't not being tested correctly. And we got it at the medical college. It is working. You have 50 children already?
We have 50 children on it, and the results at this point I would still say are very preliminary and still anecdotal. It's not a comparative trial. We're looking at each child compared to their condition before they started the medication. But the majority of them that have gotten far enough along to be able to make that comparison look like they're seeing a benefit.
So this is working, and it is a controlled substance. You don't have to worry about who's making it and whether it's really what they say or whether it's illegal. We have it coming in through a legal channel. It's made by a British company, and it is made from marijuana, and it doesn't have any of the THC.
Very, very
small
amounts, well under 1%.
1%.
A fraction of 1%.
So it doesn't have so people didn't want to hear it that there was something coming to help people. But I really appreciate everything that you did, everything that the college did, Margie, everything we did to make that available. And we do get it on compassionate basis, which means all the children get it, right? I mean, none of them are controlled. And they will, my understanding, they'll get it as long as it's being studied until it's either something happens and it's told, the FDA tells them not to use it, or that it goes on the
Right. So
market.
The company is still working to get their approval from FDA, and our study is one that has gone through the FDA and DEA processes, as well as through the state of Georgia Board of Pharmacy as well, or for oversight.
Okay.
But yes, the intent and the hope is that they will be able to continue to receive the medication from the company until such a time as they're able to show efficacy and safety, and that leads to an FDA approval, or till they are not able to show that, and they stop the study because it's not safe and or not efficacious.
But I think if I read something or heard about it, it looks like it's well on its way to approval. It looks like it.
The results so far look promising, and obviously they're going to have to compile all their data, submit it to the FDA, where it'll undergo intense review. But yes, and where we will be starting our first child on their second year of therapy come December. Next month now.
Thank you for that. Thank you for working through that issue. And this is my personal opinion, offering a scientific, safe alternative to the other things that are available out there and are being marketed. I know the FDA is coming down already on some of the oils and stuff that are being sold, because they are, they can't, there's so many of them out there that they're just now, the FDA is starting to say, wait a minute, we tested it and it doesn't have in it what it's supposed to have. And so thank you very much for that. Okay, to fibroids. Thank you.
Okay, uterine fibroids and infertility is the topic I was asked to speak about. And what I thought I would do is give a little bit of an overview about fibroids, and that job will be very much easier than I thought it might have been because of the excellent presentation from Dr. Davis Williams. And unfortunately, I didn't hear all of Dr. Gray's presentations, Ms. Gray's presentation, just the end, but information that from the questions you were asking, clearly she had shared as well.
Okay.
What I will do, though, is also, with the information that I'm providing, identify potential research questions which are unknown. As you heard, there's so much we don't know about fibroids, and it has such a big impact on so many women that it really is something that we need to be learning more about so that we can understand how it comes about, the pathogenesis of fibroids, what we can do to minimize their occurrence in the future, and then for women that already have them, what we can do to minimize symptoms, allow them to preserve their uterus if they desire to preserve their childbearing capacity, and identify as minimally invasive approaches as we can for times when therapy is needed. And okay, so what are uterine fibroids? As you've heard, uterine fibroids are smooth muscle tumors of the musculature of the uterus, or the myometrium. This picture is showing one right here. So this is the uterine fundus. The bottom part here is the cervix, and this is a patient that's undergone then a total hysterectomy. And this structure here is a large uterine fibroid coming off of the uterine wall, protruding into the uterine cavity. As you heard, these tumors are hormonally sensitive. In response to estrogen, they grow and get larger. And the overwhelming majority of these are benign. And so we call them tumors, but they're a benign type of tumor as opposed to a malignant neoplasm. On rare occasions, and exactly how often is one of the things that's been debated by the FDA recently with some of the questions that have come up. But in rare situations, uterine fibroids can actually be cancerous, what are called leiomyosarcomas. And the FDA has had numbers which are about 1 in 350 women who are having fibroids removed, surgically removed. There are individuals who have published in the gynecologic literature that say that number may be much smaller, maybe 1 in 1,000. But still, if you're that one, it's a very, very significant factor because it's a very lethal disorder, very a poor success rate compared to some of the other cancers where treatments are now better. And so what we need as a research opportunity is a way to, if an individual is diagnosed to have a uterine fibroid by pelvic exam, as Dr. Davis Williams was saying, or an ultrasound, what would really be very, very nice is to be able to have a diagnostic test, a blood test would be ideal, by which we could differentiate which women have benign uterine fibroids, which would be most of them, but who are the exceptions that have a leiomyosarcoma, so that those would not be observed, those would be intervened on appropriately, and appropriately for someone who has cancer. We are conducting some work at Georgia Regents Medical College of Georgia, which may be helping to identify a serum test in the future, which may be helpful for to make that to be able to distinguish between those two conditions. So how often do women have uterine fibroids? Well over half of all women develop uterine fibroids, and among African American women, it's even higher. Probably 70 to 80% of women develop uterine fibroids. It tends to occur in individuals in their 30s or 40s when it becomes most prominent as far as age and highest instance, but often it is present at an earlier age, but at that time may be smaller. And as you heard, uterine fibroids are a very leading indication for hysterectomy among women in the United States. A question that we need to be asking, which is not well known, is why are fibroids so much more common in African American women than Caucasians or individuals of Asian descent or other races or ethnicities? Again, we have some very early research suggesting that within the myometrium, the muscle of the uterus, there are actually stem cells, progenitor cells, or early cells from which uterine fibroids will develop. And the early work is suggesting that those stem cells may be more frequent in women of African American descent than among Caucasians. Now the question then becomes, what regulates those stem cells, which are, single cell, wouldn't even see it without a microscope, and allows them to develop and grow into a uterine fibroid which becomes clinically significant or not. It is known, some of the comments earlier were about genetic linkages. It is known that probably about 60 or 70% of fibroids, the tumor itself, do have genetic changes. And then one of the most common is a disorder called MED12. Again, what causes that change to occur in some people and not others are things that we don't know. But so we are beginning to identify genetic links, and the question is, what is, how is that regulating fibroid development, and what is causing these changes in those fibroids in those individuals? What symptoms do women with fibroids have? Again, as you've heard, they can present as an individual with a pelvic mass, with or without fullness, and with or without pain. And as was mentioned, not always abdominal pain, can be back pain as well. Individuals can have heavy and or prolonged menses, and with this heavy bleeding, they can often become anemic, have low blood counts, and have symptoms from that. If the fibroids are impinging or pushing against the bladder and bowel, as you heard from Dr. Davis Williams, you can have symptoms related to those organ systems as well. And fibroids can also contribute to pregnancy loss or miscarriages, and also to difficulty conceiving or infertility. And so a research question that this suggests is the need to be able to identify which fibroids cause or contribute to pregnancy losses and infertility.
Yeah.
And maybe the simplistic answer is going to be ones that relate to the uterine cavity, but that may be just it. That may be a simplistic answer as opposed to all of the information. There is one paper we published years ago that showed fibroids that were in the wall of the uterus, if they were over 5 centimeters in size, even if they were not protruding into the cavity, also were associated with decreased ability to conceive. And the question is, what is the mechanism for that?
Okay, here we
Now,
go.
this is a diagram showing fibroids on the uterus, and Dr. Davis Williams described these different types. I'm going to try to get the pointer to show up again. A minute ago, there it is. So you can have fibroids that are on the outer surface of the uterus, which can be on the stalk, and then are called to be pedunculated. You can have fibroids that are on the outer surface of the uterus, which are called serosal or subserosal. You can have ones that are protruding into the uterine cavity, which are submucosal, and you can actually have fibroids that go all the way from the lining of the uterus, the endometrium, all the way out to the outside of the uterus, which are called intramural. And you can also have fibroids not only in the top of the uterus, the body or the fundus of the uterus, but also in the cervical portion. And some of the research that we are currently doing suggests that those stem cells that I was mentioning tend to predominantly be located in the cervical region of the uterus. And so a research question has come up is why do fibroids commonly occur in this area, the cervix? And it may be because that's where these stem cells are located, and that's what the fibroids are emanating from. So how do uterine fibroids cause infertility? This is actually a topic that's been debated back and forth. First is the potential for disruption of blood supply to the endometrium overlying the fibroid. So you can imagine, if you look at this fibroid that's protruding into the cavity here, if an embryo that came through the fallopian tube and happened to land on the endometrium that's overlying that fibroid, the blood supply that would come normally is going to be impaired compared to any place else in the endometrium. And so the likelihood that pregnancy would miscarry, we think, is increased. And in fact, it may miscarry so early that we wouldn't even be identifying that person of having conceived. This diagram is actually shown such that the uterine cavity is distended. In reality, though, unless you're putting fluid in for a sonohistogram or some other imaging study, one wall lies right up against the other. And so if you have a fibroid, such as the one that I was just showing, if it's pushing against the endometrium right next to it, you can also have pressure injury to the other side, which we think may also contribute to difficulty in conceiving. There are also suggestions that if you have fibroids protruding into the uterine cavity, you can have an inflammatory-like response, which makes it a more hostile environment. And so the embryo, as it comes down from the fallopian tube, would be exposed to inflammatory cytokines and growth factors, which might make it more difficult for it to survive and then therefore be able to implant. Also, you heard that some uteruses with fibroids can make someone look like they're 7 or 8 months pregnant. So that then becomes a very long distance for the sperm to traverse in order to be able to meet the egg, which happens in the fallopian tube, to conceive. So it may just be a function of distance in some situations. And then lastly, if we look up here, is a fibroid that's depicted actually occluding the fallopian tube, so that would not be able to have a sperm go up or embryo come down, and that may also contribute to difficulty in conceiving. This then leads to the research opportunity for being able to identify treatments for fibroid-related infertility related to any of these particular types of fibroids that are causing infertility from any of these potential mechanisms. Now, as you heard, the fibroids can be treated in many ways. One of the ways is with what's called a resectoscope, which is pictured on the right, and this is used to treat a submucous fibroid or one that's protruding into the uterine cavity. And with this device, it has a loop on the end, very much like what the urologist would use for a man who has an enlarged prostate. You can basically shave away that part of the uterine fibroid that's protruding into the uterine cavity in order to make a more normal uterine cavity to help these individuals conceive. One of the concerns when you do surgery and you leave a raw surface area, though, is you can develop scar tissue after that procedure. And there's a fancy name for that called Sherman Syndrome if it's related to the uterine cavity. And the question becomes, what is it we can do to minimize that or to be able to assess the women after the procedure to see if they have it, and if so, then to be able to treat it. You also heard that there are other approaches to treating uterine fibroids. Fibroids that are in the wall of the uterus, on the outside of the uterus, can be treated in many different ways. Surgically, you heard about hysterectomy as an option. And the top 3 diagrams there are depicting different types of procedure, removing a portion of the uterus, or which is the upper left, what would be called a supracervical hysterectomy, the entire uterus going down, including the cervix, where you'd be making the incision in the vagina, or for individuals who had some sort of endometrial cancer or other sort of malignancy, you might have a radical hysterectomy, which is what's being depicted on the right. It's also possible to perform myomectomy, where you're removing the fibroid or fibroids themselves. And as you heard, Some patients, this may only be a single one, but other patients can have 20 or even more. And as you also heard, these are often not always picked up on imaging evaluations that are being done. There are also other approaches surgically, electrosurgical, which basically applying electrosurgical energy to the fibroids, and one that was recently cleared by the FDA called radiofrequency ablation, where doing ultrasound during the operative procedure itself, able to visualize the fibroids and direct a probe into the fibroid and apply the radiofrequency energy in order to try to treat it in that local location. There are also a number of medical options. These include primarily agents. We mentioned that fibroids are estrogen-sensitive tumors, so you would think if we could have medical approaches that would reduce estrogen, we could make fibroids shrink. And in fact, it does. The first one agent that was available is something called GnRH analogs, which basically suppresses ovarian function. There are others that are being evaluated now by a number of pharmaceutical companies, which are called SERMs, or selective estrogen receptor modulators, and they may hold some promise. But an interesting and potentially exciting approach, which has been done by one of my colleagues who's now with us at Georgia Regents, has been using a green tea extract called ECGC, and in a small series of patients, 70 patients altogether, half treated, half not, have been able to show a decrease in the size of uterine fibroids. And the same investigator has done work with vitamin D. African Americans tend to have low levels of vitamin D compared to other races. And what he's shown, both from cell culture models, from animal studies, is that giving vitamin D appears to reduce the size of fibroids and some of the molecular changes that go on in the presence of fibroids. We've been trying to get funding to do a clinical trial to look at that in humans, and unfortunately have so far not been able to been successful in receiving that funding, but that would be a very interesting place to go. There are also radiologic approaches, as you heard about. The middle picture here is showing what an interventional radiologist would do, where they would put a catheter into the femoral artery and redirect it into the uterine artery in order to place these very little particles in order to disrupt flow to the uterine fibroids. It also actually disrupts flow to the uterus, but the uterus tends to recover much quicker than do the fibroids, and that's why we think it's effective in helping to treat fibroids in these women. And there's also a new procedure, new is now maybe 10 years, MRI guided ultrasound ablation. So this is not just imaging, but this is using the MRI at the same time of the procedure and then focusing ultrasound to try to treat the fibroid as the individual is laying inside the machine. So I've already mentioned a little bit of the research opportunities and the desire to have a minimally invasive approach to try to treat uterine fibroids. And the question is, if some of these medical therapies are able to treat uterine fibroids, might we be able to use them in some ways to minimize the likelihood of their occurrence? Now, for some of the medications we have now, like the GnRH analogs I was mentioning, we wouldn't want to do that, because if women are on those medications, or actually men also, but in this case for fibroids with women, if they're on those medications for more than 6 months at a time, there's an increased risk of decrease in bone density, increased risk for bone fractures, and so it's usually a time-limited period of time that we'd be wanting to reduce estrogen. But if giving vitamin D, for example, would be something that would help with the fibroids, that's something that potentially could be done as a preventive therapy. But again, that's at this point a hypothesis that requires true clinical trials in order to investigate and see, number one, will it really treat uterine fibroids? And number two, could it be done in individuals who have family histories or otherwise predisposed? Can they be used to minimize the occurrence of uterine fibroids in those individuals? Are there concerns with sequelae to myomectomy? The desire often is to retain the potential for a woman to have children if she so desires, and so a myomectomy would be done as opposed to a hysterectomy, removing just the fibroid. But what often happens in that situation is that afterwards there is development of adhesions or scar tissue that developed to wherever the incisions were, And this is particularly worrisome from an infertility point of view if that incision's on the back side of the uterus, or the posterior uterus, because that's where the ovarian tubes are. And as you see in this picture on the right, you see some examples of adhesions here that have formed to the uterus, and this is going to the omentum. And on the left here, you can see pictures of the uterus. You see portions of the fallopian tube. You see either omental or bowel fat that's here. And you can see the ovary and the tube are all enmeshed in this scar tissue. And that's going to interfere with the ability of the tube to pick up the egg after ovulation. And therefore, you may have treated the fibroids, but you will have created potentially a mechanical contribution to why these women would have difficulty conceiving in the future. Now, one of the big issues with fibroids, and this has also been brought up already, but to emphasize, is that when you give medical therapy for fibroids, the majority of them shrink, but after the medical therapy is stopped, they often go right back to the size that they were. And if you do surgical therapy other than a hysterectomy, if you're doing a myomectomy procedure or these other surgical approaches that I was mentioning, a year later, or 3 years later, or 5 years later, it's very common to have a recurrence of uterine fibroids in those individuals, particularly if they had multiple uterine fibroids to begin with. And so this can become a recurring issue for these women, and it becomes a clinical challenge of what to do for them as a result. And so one of the questions that more research is needed on is what can be done to prevent or minimize fibroid recurrences. This is my last slide, and ask the question, what would be helpful to minimize the consequence of uterine fibroids? Research funding to study fibroids would be helpful to look at a number of different issues that I've alluded to, and these include understanding factors leading to development of fibroids, so preventive strategies can be evaluated and implemented, development of approaches to limit or prevent postoperative adhesion development after surgeries, and the development of safe and effective non-surgical approaches to treat uterine fibroids. Fundamental to all of these sorts of approaches, though, as we were hearing before, is understanding what is the natural history of fibroids, how often, and how are people being treated, and what are the outcomes that those women are experiencing. And that is the purpose of the uterine fibroid study that you heard about, which is being funded by 2 governmental agencies, AHRQ and PCORI. It is being led by a group out of Duke, and there are 6 other centers that they identified that are participating with them as part of that study. They've invited me to be on the steering committee for that study, which I've very gladly accepted. But as you heard, none of those sites are here in Georgia. And obviously, we had actually applied for this grant as well. We had hoped to be able to do the study in Georgia as well as elsewhere in the country, and that would be something we would continue to strive for in the future as that study moves farther along. So I'm going to stop there. I'll be very glad to take any questions. Again, I very much appreciate the opportunity to share with you many of the problems that women have with fibroids, and the hope that we can learn more about how they're affecting women here in Georgia and what we might be able to do to try to learn more about them so that we can minimize some of the difficulties and problems that they cause.
Okay, so to sort of summarize from, let me get this straight, and I'll go first, and I'm sure I'm not the only one that has questions. We really don't know what causes them. It may be sort of a stem cell. Do we not have further research into what causes them because it's so difficult, or is it because there's been a lack of research done? I mean, are we just now starting to do research?
I think research is, well, there has been research done all along, but I think now with the molecular techniques, with stem cell technology becoming of interest in other disciplines, such as cancer and regenerative medicine, that we're now getting to a point where we can really apply those sorts of evaluations to the problem of uterine fibroids as well.
Okay. And since they develop in the 30s and 40s, mainly, or start develop.
That's where they're usually, individuals usually present with the symptoms.
Oh.
Most likely they're starting at an earlier age. Okay. But that's where the individuals are usually presenting and where with the symptoms and come to see their gynecologist specifically about their fibroids.
Which would mean that they've probably gotten big enough to cause
That's right.
the symptoms. So with women delaying pregnancies because of careers and all, and into their 30s, their late 30s and their 40s, may be the reason that we're running into such infertility problems.
That definitely contributes as well as just general decline in likelihood of being able to conceive for any reason as you're getting into the 30s and beyond.
Okay. And of course, the hysterectomy takes away that ability to ever being able to conceive. Do we know at this point of the procedures that are interventive procedures? Do we know which ones so far where there's a better chance of a pregnancy afterwards, or is it?
Well, we do know that women who have fibroids, if they then have a myomectomy, their likelihood to conceive, there are studies which look at how often they conceive afterwards, and it's higher than before, otherwise they wouldn't have entered the study.
Of course, but
the problem is they're often not comparative studies, and probably will never do a study where you, with a randomized study where you're going to randomize people to no surgical therapy versus not. But it is the hope of the uterine fibroid study that you were hearing about, and that I've mentioned as well, to be able to look at some of that natural history of what is happening in individuals as a registry type evaluation, which would then be impacted by whatever that patient and their physician decided as far as surgical approaches, medical approaches, or just observation.
So we're really just not keeping that kind of information that would.
It's not together in a comprehensive form where we can ask the questions of it that we would like, and hopefully a registry would begin to allow us to do that.
And one of the biggest complications after the surgical that would prevent pregnancies, is it because it's in such a small area that you're working in, and everything's pretty close anyway, is it because of the scarring that usually occurs that would perhaps present the biggest problem or the biggest complication?
For individuals who have fibroids who want to conceive, they obviously could have other coexisting problems as well that are contributing to difficulty conceiving, either involving the wife not ovulating, or it could involve the husband
sperm levels.
and poor sperm counts. So, but as far as sequela to a myomectomy and that are contributing to difficulty conceiving, I think yes. The adhesions that might develop either inside the uterine cavity, if that's where the surgery was, or outside the uterus is the concern. And that probably occurs between 80 and 90% of the patients who have surgery on the posterior surface of the uterus. So very, very common.
To have the adhesions. Okay. Questions from the committee? Okay. Questions? All right. Uh-huh.
Dr. Diamond, you talked about a procedure, I think you said green tea?
A green tea extract, yes.
Okay, and could you tell me a little bit about that, please?
So it's a small 70 patients, I would call it a pilot study, which randomized patients who had uterine fibroids to either receive the green tea extract or to not receive it, and then look over a period of months as to what happened to symptoms such as how much bleeding they were having, how much pain they were experiencing, quality of life, as well as a serial evaluation of the size of the uterine fibroids by ultrasound, the number and size, in order to look and see whether it was being effective.
Okay, so this study's going on now at the GRE.
No, that initial 70 patient study is complete, and it's actually been published in the literature.
Okay, and what were the results?
That it was successful.
It was
in helping to
successful.
reduce,
Okay.
the size of the fibroids, and it was also successful in reducing symptoms that the women were having.
Okay.
And is it green tea extract like you get at the health food store?
Yes.
I was wondering.
Okay.
Okay.
Now that remains to be confirmed
Right.
in larger studies, obviously, but it's an exciting finding that needs to be followed up on.
I was going to say, if I was trying to get pregnant, I think I'd ask to have my vitamin D levels checked and maybe go to the health food store and get green tea. It couldn't hurt you, but anyway, it's interesting that that those two factors,
Yes.
but especially the vitamin D. I mean, our bodies are such fine-tuned organisms when they're working, and when we don't get enough of it.
We're learning a lot about vitamin D. We're also learning about vitamin D and its role in preterm deliveries, thinking of other obstetric gynecologic conditions. Also, though, involved in metabolic disorders and likelihood of developing diabetes. So it's a lot being learned in a very short period of time about the potential value of vitamin D. But it is possible to get too much.
Right.
So you shouldn't just be...
Well, I'm well past that age. I wasn't just going out and try it, but especially if you can test and see if you're low in it.
Yeah.
So you're having, if it seems that vitamin D is also a factor in people delivering early and premature babies, it seems like it might have something to do with their attachment or something to the line. I mean, and we could certainly use that. Is that being studied at the medical college too? Because we have such a high rate of preemie births.
Delivery at this point is not being studied, no.
Okay.
Something we would like to, and we are, again, my colleague, Dr. O'Hendy, is conducting a study in conjunction with the American College of Obstetrics and Gynecology to identify physicians' opinions about use of vitamin D during pregnancy.
Okay, because we have such a high rate of preemies in this
We
state,
do.
and it would be wonderful to find that there was something that simple that we could supplement. That's also, it seems we have a higher rate in African American women also on that issue, and so the two seem to be
That's right.
in some way related if it's working.
And it may be related to the increased likelihood of having low vitamin D levels in African American women as compared to Caucasians and Asian individuals, Caucasian Asian descent. So it may be a common denominator of having low levels.
But in both of them. Okay. Other questions? Okay. Ms. Representative Thomas?
I want to get a little bit more information about the grant of this. And is it a grant that's in another state, or is it here? Or tell me a little bit.
So the grant about uterine fibroids,
Right.
there was one grant like that was funded across the country. It is based in North Carolina. That's where the coordinating center is at Duke University. And they have 6 clinical sites that they are partnering with their submission. And none of those were actually located within Georgia. So they're in other states and other parts of the country.
But the registry, I guess I'm confused about this.
Yeah.
So their study, the request that came out from PCORI and AHRQ was to put together a proposal which would include, number one, a registry, as well as 3 clinical studies that you would do, all related to women with uterine fibroids. And it's structured, you had to have a coordinating center, and then between 6 and 10 clinical sites around the country that were going to participate with that center in conduct of the study. And that's what they have. They were successful in being funded for that project, and they are now in the process of getting ready to start it, they have to go through an IRB process as part of that study as well.
So the registry is part of that study
That
for
is
the
part
people
of
who are
that
just
study.
participating in that. Are there any states that have a registry just for that you know of for just where on a state level the doctors report?
I am not aware of such a registry, no.
Okay.
No.
That's something we can look up. Okay, but it sounds like if they have good results with this one, it's something we may end up with it expanding.
It would be my hope they would do so, yes.
Oh, who did? Oh, Denise, okay.
The press release for Compare US, I'm sorry, the press release for Compare US is in your packet. I serve on the stakeholder committee as well as Dr. Diamond, who's on the steering committee, but we're all on it's the same group.
Okay.
So that is in your packet.
Okay.
The press release about Compare US.
Okay.
Thank you.
Other questions? Anything else? Okay.
Why didn't we get the grant? I mean, I'm just saying,
That's a great question. It's an evaluation, and actually any of the granting processes, whether it's these organizations or NIH, ultimately they don't tell you that. They tell you who won it. They give you comments about your application, but we never get to see what the comments were about the other application. And then the councils that actually make the decision after the grants are scored, their thought processes are not something that is usually made public. So don't have an answer to that question. I wish I knew. We know what we could do to
To
improve
improve it
next
in the
time.
future. It's like that. So we have other questions.
One more. So in other words, who specifically put in the grant for our state? Who was the entity?
I was, it went through Georgia Regents and Medical College of Georgia. I was the PI of that submission, and it was, we were both the coordinating center as well as we were going to be one of the clinical sites, and then there were 9 other clinical sites around the country that were going to partner with us in that application.
Will it come up again?
Don't know the answer to that. There was no mention of that in the original request for applications. Whether that will probably depend on the results that they get from this initial 5-year funding period, and then they will determine whether that still meets sufficient high priority for the 2 agencies that help co-fund it, AHRQ and PCORI, as to whether they would reissue an RFA or not. A request for application, RFA.
Okay. I think the one thing that I forgot to ask, and how common is it in, if somebody's mother had fibroid tumors, a girl, is there a high chance, does it go?
I don't have a number, but yes, it's very common for individuals who are presenting to the Office of Fibroids to say that, yes, their mother had fibroids as well, or had a hysterectomy because of fibroids, or an aunt or a grandmother. They're a very common thing for us to hear.
So there's that familiar type thing, and it's just, but here again, we don't have the statistics on it or anything because of the like that. Are there any other questions? Anybody has it? Thank you so much for rushing by and to see us. I know you have a over 2-hour drive back to Augusta.
I appreciate the opportunity
And
again.
hopefully, if you hurry and get on the road, you might miss some of that Atlanta traffic to get back. So Marjorie, thank you for getting Dr. Diamond to come. Tanika, thank you for getting our other doctor that we want to come back to the women's group and to have you come and do that, Dr. Williams. So I really appreciate it, and we'll get Margie to keep us updated if I'm interested in the green tea. Considering the fact I drink, if I'd only drank that gallon of green tea I drink every day before I had to have a fibroid hysterectomy, it might have prevented it. So thank everybody for coming. I'd appreciate it, and thank you for all the work Tanika, that you were doing. And I tell you, Dr. Davis Williams, thank you for taking care of the patients in Georgia. Practicing medicine is getting harder by the day, and I appreciate everything that you've done, and Dr. Diamond for that backup research. It's amazing as we learn more about the human body and how things can be done differently, and hope will be happening, especially for the women who want to have children and can't, that we'll find some way to help them to have that lifelong dream fulfilled. So thank you very much, everybody, for coming. We're dismissed.